Hello there.
Sir, I have missed you. I have missed your handsome, charming face.
I and I've missed you in the same uh weird but not weird way. So yes,
Yeah.
it's really great to see you, buddy.
Yeah. Well, for our listening audience or our viewers, we have we were so far ahead in recording the season that I actually took a vacation. And as a result of that, I have not seen PJ in I think
Oh
two
wow.
weeks.
Yeah,
Yeah,
that's
which
true.
is probably the longest I haven't seen you in like 2 years.
That's true. What's a vacation?
Yeah.
Can you describe it for me,
As a matter of fact, I can. It's getting on a cruise ship,
please?
standing in line for many, many hours just aboard, with children. My grandchildren were there. My girlfriend's kids were there. Some of them were better than others,
Sure.
in being patient about it. Although actually all of them did a great job. They were all wonderful on this trip. And then PJ, vacation is having your wife's new book, The Takeover, with me as my entertainment. And you know what? I'll be honest. I bought the book. I knew I was going to at least open it, but I wasn't sure to actually read it.
Fair.
And the book is fantastic. I got to tell you, it's hilarious. It's lively. I have thoroughly enjoyed it. So for our listening audience, Kara Tanamachi's new book, The Takeover, which is a
Just became
bestseller.
USA Today nationwide bestseller. So
Nice.
good. You can find it in Walmart's and Barnes and Noble. But thank you, Tal.
Can I tell you that I know they made a movie out of her first book. This book should be a movie. I could literally see it being a movie. It's perfect for that. I hope that you know who we know some people that might really dig
we know a couple
uh
of people. Yes, we do.
yeah,
Yeah.
especially for the Asian market. So anyway, you know what? It's a good opportunity. The fact that your wife published a book, I believe, on January 30th, and our guest today published a book that came out on February 6th, right? Mary Marie Helene, I'm going to call her MH this entire interview because I cannot say her name properly. Marie Helene or MH Pelletier,
LTA. LT.
Pelletier is our guest, and PJ will introduce her in a second. But your book came out, I think, February 6th, right?
It did. Thank you, Tal. And you did manage to pronounce my name. It is long French and complicated, but MH works perfectly well. And yes, we're literally book sisters, me and PJ's wife, just like that.
Yes.
There you go.
We expect to see you at Christmas time.
Perfect. We'll be there.
Awesome. Well, you know what? How about this? Let's have everyone meet the wonderful Miss Marie Helene. So I personally am thrilled to introduce Marie. Sorry, it's Dr. Marie Helene Pelletier, better known with her colleagues and Tal as MH. She brings a signature mix of business and psychology to the table. She holds both a PhD and an MBA. She translates psychology research into strategies for professionals, business leaders, and their teams when they need to thrive. She shares what psychologists know, but other professionals and business leaders may not, which is about resiliency, specifically the intersection of successful work performance and strong workplace mental health. She has over 20 years of experience as a practicing psychologist and a senior leader in the corporate, insurance, governance, and healthcare sectors, work for which she has won numerous academic and industry awards. Very recently, in early this year, 2024, she published her award-winning book, The Resilience Plan, a strategic approach to optimizing your work performance and mental health. Marie Helene is also a member of the Global Clinical Practice Network of the World Health Organization and past director on the boards of the Canadian Psychological Association and the International Association of Applied Psychology. Dr. Pelletier, thank you so much for joining us on the Braving Business podcast.
Absolute pleasure. And thank you for this great introduction.
He does very well with the introductions, doesn't he?
Yes.
PJ, that is one of your core strengths as a human being. You
Thanks.
introduce people with such verve. Anyhow, Dr. Pelletier, thanks for joining us. It's great to have you. And there's a lot to cover and so much about your journey that's so interesting to me. And I want to start, if we can, at the beginning. You started your practice in Northern Quebec, and initially was, as I understood it, just straight up psychology, right? You were seeing patients, and it was normal practice. I'd love to know what drew you to psychology, but I'd also like to understand how you transitioned from that to where you are now.
Yes. Yeah. Well, interested in humans in general, and seeing the research and how we could use so much of what we know from research to avoid pain, really. And when we implemented that, the amount of changes. And part of what happened in me early career being in Northern Quebec, uh, is when you're one of very few psychologists in a remote region, and all this, of course, is prior to the remote work, the FaceTime, the internet, the telehealth, all of this. That meant that the few of us that were in that small, isolated town were doing everything, literally. Like I was doing everything. One of the things I had the chance to do, and all this I was getting supervision from the city to do, because what do I know? But one of those things was employee and family assistance program. It was early days at the time of EAPs. But what that allowed me to see is how, if we are proactive, which is often how people end up consulting in EAP because it's free, it's confidential, it's easy, they were consulting proactively. And that planted the bug for me about being proactive, being in the workplace, bringing psychology and business together. And that led to a number of other choices that got me where I am now. But that's where it started.
Very cool. Very cool. And for those of us, we kind of live in our own microcosm here in the US. When you're talking about Quebec, obviously the major city there is Montreal, and then there's of course the capital, Quebec City. But what when you're saying Northern Quebec, like what does that look like in regards to population? It doesn't sound like it's very
Are there
robust.
more bears than humans where you live? That's what he's asking, but
You
politely.
ride a moose to school, like what happens up there?
There were more mosquitoes than anything, really. So before you go, people tell you it's nice and beautiful in nature. And then you get there and the trees are like this. If you're not seeing my hands, they're like so thick together that you cannot enter the forest. And so it's very flat area. So it was a 10-hour drive from a major city. No movie theater, no nothing. At the time, 8,000 people town. Closest town had about 15,000 people. And within 1 year on one car, we've put over 100,000 kilometers between me and my husband, because between him going to where he was going, me taking the car, going to this city, going to this city, not kidding, over 100,000 in 1 year. And so that was life in a remote area. Yeah,
Jeez. All right. So now you're back amongst the living.
that's
And
right.
you've transitioned from a private practice to corporate roles, and now you're consulting with and also doing executive coaching. So was that transition intentional, like get me away from these mosquitoes, or did life and circumstances just lead you there?
Yeah, number of steps. So this small, isolated, flat area was not where we wanted to stay for the longer term. I was interested in the program at UBC. We were interested in mountains in general. So made the decision to move to the West Coast in Vancouver, which is where I did my doctoral research at the time in telehealth. As it turns out, I was studying can we possibly provide psychotherapy via video conferencing at a time where FaceTime did not exist? I had to use 6 telephone lines to transmit video and audio data. At the time, it went nowhere because right after that, I did my MBA. And we actually used this because everyone was like, oh my God, this is the way of the future. Let's pitch this as a possible business idea. Pre-embryonic. No one was even wanting to listen to this. So, but that is doing this type of research that led me to doing business, because in order to do this research, I needed to have a lot of funding for the technology. I needed to oversee the work of many people without being able to pay them. So a lot of management and leadership involved. That's where the idea of continuing more in management and leadership came. And then from there, the corporate roles, and then where I'm now.
And there you are. So how has your approach to mental health evolved as you shifted from private practice to the business world?
I was already fairly practical about it, probably even more than many of my peers, which is in part why I have a different profile, I guess, that combination. But it made it even more practical. It was practical. It became even more practical. Having been myself in those roles where life gets so busy that it feels like I have zero time to invest in any aspect of your psychological health, because you've got people to take care of and operations and other things. So I experienced it. I've worked with others experiencing it, and that made the need to bring psychology to business even more laser focused.
Okay, very cool. And so just one real quick step back. So you go to the University of British Columbia. I'm assuming that's what UBC stands for.
Yes.
And you're in the beautiful West Coast now, and you are basically looking at doing telehealth services basically over Skype. Was Skype even around back then?
Nope.
Wow. All right. So you were ahead of your time.
Tin
Yeah.
cups, PJ, tin cups and string. That's what she
Yeah.
was looking to do
Yeah,
with.
I
It
think
sounds
so.
like.
I think so. Polaroids and, sending them.
Mhm.
Amazing. Amazing. Well, then you certainly saw a large need, especially during the pandemic, right? Like, Skype was in this space for years, and then pandemic happens, and all of a sudden everyone's on Zoom. And I feel sorry for Skype, but I don't know what happened to them, but Zoom became
How about Team Viewer? Remember that? I mean, actually, I thought Team Viewer was out of business until I recently realized they're on the jerseys of Manchester United. Team Viewer. I don't know who uses that anymore for what, but there you go. They're still around.
well, there's still money in it, I guess. So
Mhm.
this concept of strategic resilience, that is something that you've talked about, your laser focus, you've focused on as being a central part of your work. Can you explain to our audience what strategic resilience means, and where do you feel it comes into play?
Mm-hmm. It came into play when I started using this analogy when working with individuals that would come to me and say, MH, I don't know what my problem is. I've been going through all of these massive demands with resilience, with everything going through. Now I have this situation now, and somehow I can't seem to be going through the way I have always done. What's my problem? And and then I would say, well, it likely has to do with your resilience. And he would look at me like, no, find me something more complicated than this. It can't be that simple. And then I would say, well, wait a second. If we are in the business context here and you have this a remarkable idea for your next product or service, would you just go ahead and proceed with it? Or would you first connect it with your values as an organization, the current forces in the market, who's already providing something like this? How much are people willing to pay for it? All these things. And of course, you would do all that. That would be part of building your strategy. And so here, same thing. If all we're thinking is, sure, doing exercise or whatever would be helpful, but I don't have time, we don't do it, and that's just it. The way that we will actually be able to incorporate in our extremely busy, overflowing lives, ways to build and protect our resilience and sustain it over time is by being strategic. Therefore, taking into account our actual current individual context.
All right, let's bring it down to my level, which is like fifth grade. Okay. So resilience, obviously, we know what that's all about. That's the Braving Business podcast is all about resilience. We believe that one of the most critical skills that anyone that is interested in entrepreneurship or is an entrepreneur needs to possess is resilience, because so much goes wrong so often. And nearly everyone, probably 99% of entrepreneurs, have experienced significant challenges and setbacks on their path to wherever they are. And oftentimes it is that experience that leads them to be successful entrepreneurs, and frankly, also better human beings. So when you talk about strategic resilience, how is that different from just plain old resilience?
I know. Well, the plain old resilience, the definition of it, like you said, just so we're all even with everyone with us today, our ability to go through adversity or demands and come out even stronger. So we're growing from it, and adversity could be acute demands or chronic, and often we've got both at the same time. A load of chronic ones and then the additional acute ones. All right. So that's that. Okay, resilience. But resilience is not a personality trait that's like within us, always there. Thank you very much. Keep moving on. It's a state. It's something that will be at times higher, at times lower in our lives, which means if we invest in it, we can increase that baseline and therefore have it higher for the next waves of chronic and acute demands. So, and if we are strategic about it, what that means is I'm not just aware of the things I could do that could increase my resilience, which we could call just resilience. If we are strategic, for each of us, and that's in part, there's different process, we can get in the details of that. But what we're doing is we're looking at a current context, what my values are, what are the current demands I'm facing, where are my sources of supply, what forces in my personal life, internal to me, external to me in my context, like a SWOT analysis, what's going on there, so that I can build a plan that actually makes sense. If you want me to give you a quick example, I could do that too.
Please. Yeah, I think that would be really cool.
Because so if we're just thinking about resilience, we may be thinking, sure, exercise would help me, eating well and taking vacation, for example, right? But then for many of us, what will happen is life is so busy that we do none of this. Last vacation's over a year ago. No, we're not eating that great. We wish we exercised, and maybe we did 5 months ago, but we haven't done anything almost for the past 2 months. If we're strategic, and in fact, Tal, are you feeling like we do a case study on you? You only say things you feel like saying, but I would ask you a few quick questions just to give an actual example that's based on a live human here with us.
Let's do it. I'll take the risk of embarrassing myself.
I'll be friendly, I promise.
Many people. Go ahead.
Okay. If you give us, and you can invent, you don't have to be like fully transparent here, but give us an example of maybe 2 or 3 of your main values as a person, whether it's personal, professional, doesn't matter. Just 2 or 3 things really important for you in life.
Kindness and respect.
Okay. Then tell us about, completely separate, but just so we have this, in your life right now, and again, you can invent, what would be a source of, an example of the types of demands you're facing? Any demand, positive,
Any
negative,
demands?
work?
Sure. Well, I face the demands of my very busy consulting practice and making sure that I'm taking care of my clients. I face the
Yes.
demands of providing some support to my children, all of whom are adults, but in the early stages of adulthood. I faced, a new relationship that I'm very positive about. So those
Nice.
3 come to mind.
Love it. Give us sources of supply of energy. You just came back from vacation, so let's assume that was at least in part a source of supply. Anything else?
Sure. I mean, exercise.
Yes.
Human connection, particularly with the people I love. My dog.
Fantastic.
Sports.
Okay. Oh, sorry. Were you going to add one more?
I was just adding watching sports.
Oh, yes.
Soccer especially.
Oh.
Although of late, I got to say my team's been doing very poorly, so it's been kind of painful. But generally
Sometimes
speaking,
people will say this. It's funny you say this when we're going through supply and demand. Golf also usually fits in both categories. Gives me energy, but it's so frustrating that it doesn't. It can, sometimes people say this. Okay. And we won't right now go through the whole like SWOT analysis of what's going on for you, but we would in order to really gain even more clarity on your actual context now. But then we would get to your strategy. And just like in many strategic work, we'll start, let's say, with 3 pillars, and then you would have your tactics under each of them. But given a context where some of your values, and we would go to like more like 10 values usually in all, but some of what we have is kindness, respect. Right now, there's lots of demands from your clients, taking care of them, new relationship, sources of supply like vacation, exercise, human connections. You may find that one pillar, if we were to build your strategic resilience plan, maybe to protect relationships even more. So there could be a pillar called relationships, where you invest even more on the relationship aspect with your clients. You invest even more in nourishing this new personal relationship you are already, but making sure you keep doing this in the context of there are so many demands from the larger family, from the work and all this. So there may be a relationship pillar here. There may be a pillar, I'm just inventing right now, that is TAL only. So much of what's going on right now is people in your business, broader family, dog, there's many people around, and it sounds like you value all of these relationships and these people. At the same time, at times it could be distracting almost. And so finding even more TAL time may be a pillar. So I'm not asking whether you agree with those specifically right now. It's just using these as examples of where a very personal strategy could go.
I got you. So first, I should have said, PJ, that you're a source of many positive things, and spending more time with you would
You know, I
certainly
was
be
going to
part of
say,
my strategic plan.
I'm right here in front of you, dude. Hello.
I know that was bad. I apologize. You
That's
didn't
a,
have to write it to me in our internal
oh,
chat though, but that's okay.
that's
No, he did not. But I will say this: you were essentially describing what from your book sounds like the strategic resilience plan, and that was my next question. Actually, I was going to ask you, what is a strategic resilience plan? I think you just gave people some example of that, and maybe for starters, give our audience one actionable step they can take right now. And when I say right now, I mean after you finish listening to the podcast. You would not just stop listening. But when you're done, what one step can they take to start creating their resilience strategic plan?
Yes. And that's one of the questions I was asking you earlier. And I've learned from experience that this is one where often people say, you know what, when I did this, it started shifting how I think. And it's that simple. You take a sheet of paper, 2 columns, my current sources of demands, all of them, personal, professional, um, positive ones, also, and negative ones. Because sometimes if I only ask demands to people, to especially very busy entrepreneurs, they will list only work negative demands, thinking that this is a demand. All the positive things, it's not a demand. I've been wanting it. But even if it's positive, it demands time and energy. So listing all your demands, listing all your sources of supply of energy, the real ones, not I'm aiming at going to the gym 3 times a week. Realistically, have you gone in the past 2 weeks? And if you haven't, it does not go on the list. If all you've done in the past 2 weeks to take care of yourself is make sure you stop working by midnight, okay, put it there. It's a boundary, but be realistic about it. Because what entrepreneurs tend to miss, leaders as well, is often we've had almost a positive bias, right? We disregard the size of the demands and we minimize how much supply we need and we carry on. And it has many advantages because it does allow us to push us forward. But then pushed too far, it means we're not being realistic about the situation. So that 2-column perspective often then will push people towards movement, towards a strategy.
very, very interesting. So it's really about being honest to yourself, right? Like being very transparent and honest. Like, because I know like a lot of entrepreneurs, we have to not only do we have to put on the brave face for the external world to say, hey, my idea, my service that I'm building, everything is great. We're doing wonderfully, but also you have to be true to yourself. And I think what you're asking people to do is really kind of take a step back, cut out all the BS and the bluster, who you are, what are your levers, and how do we keep those in focus?
Yes, absolutely. Otherwise, here's another analogy to this. Otherwise, it's as if we would be starting a business or managing a business, and we would say, well, we're not going to look at the financial statements because they're probably fine. We would never do this. We would want to see these numbers. We would want to see them early. We would not say, well, show them to me only when there's a crisis. Opposite. We want to see trends early, pick them up, understand it, adjust early because we know it will be more effective and less painful. So same thing with our resilience. That real look at yourself that you're talking about is the equivalent of looking at your personal financial statements, if I can use that analogy, so that you are really looking at these numbers and so that you can take action early.
I really like that. I really like that. So I'm assuming that all of these wonderful tidbits of knowledge are in your book. And, you know, we are not too far after the launch of this wonderful book, The Resilience Plan, which is already winning awards. Congratulations.
Thank you.
But, you know, from a business reader, there's hundreds, if not thousands, of business books, wellness books published every year. A lot of them kind of the same stuff, right? The quote unquote warmed over regurgitations of something that just came before.
Yeah.
So how, you know, but and I think I already know how, but your book is different. Can you explain a little bit how you feel like your book fills this gap in current literature on work performance and mental health?
Yeah, thank you. Of course, I'm hoping each author knows what their unique book brings to the conversation. This book brings what we know from research and practice in psychology and frames it in a way that we already think this way in terms of entrepreneurs, leaders, managers here. We're used to thinking in strategic ways. This is not a surprising language that we have to like figure out our brain around it. We already get, and even the book is mostly for leaders, entrepreneurs, and managers and professionals. So some professionals don't necessarily do strategic work, but they connect with it very easily. And so what the book does is it brings psychology, transposes the most essential pieces into the strategic thinking so that we can take action in a customized way, which then makes a difference and will, I mean, some of the people reading the book and reviewing say, yeah, it could save burnouts because then you catch things much sooner.
Yeah, no, that's
So,
awesome. And sorry,
um,
Todd, I didn't mean to cut you off. I was just going to say two things. After listening to what I just said, I didn't mean to say that all business books are regurgitations and all that kind of stuff. Just some of them seem to be. There are many excellent publications out there, obviously. But also this, I think it really kind of brings to light just that honesty that you have to carry through on your day, right? And kind of delving into that psychology of how you are keeping yourself present through the business practice. Because like once I know I had talked to an entrepreneur before who had mentioned that he has a business coach, but he called that business coach his mental health counselor. And so he went to go see his mental health counselor because it was healthy for him to look at his business as a relationship and really work on it through that lens. So I just wanted to mention. I'm sorry, Todd, didn't mean to cut you off, buddy.
No, not at all. I actually think you were going where I was going. I think that what I'm hearing is as I am beginning to understand what you mean by strategic resilience, which I didn't fully understand before. I'm hearing you talk about having presence of mind and awareness to use some of the skills that people in the business world use as or in ordinary course of business to plan and execute against whatever it is that their goals are professionally. And your point is you want to be successful, you need to be resilient. You want to be successfully resilient, be strategic about it.
Oh, Tal,
There you
there
go.
you go. Yes, yes, just yes.
Thank you. Well, I think we can end the conversation. No, I'm joking. As you were talking, I was thinking about an early guest of ours in season one, Erez Avramov, who is a Israeli Canadian, currently leadership coach and resilience coach.
To die.
And yeah, the man who refuses to die. And I feel like we need to make a connection between the two of you because I think what you were talking about is very consistent with what he talks about. I think you've put words to some of his practices. I think that there could be some collaboration there, but I definitely get what you're saying now, right? So in effect, if I was to boil it down, you said, look, you need to create a list. On that list are going to be demands. Those are not just the bad ones, they're the good ones too. And then you need to figure out what are your source of energy? What are the things that help you meet those demands, the good ones and the bad ones, the good ones and maybe the bad ones, not the right word, the ones that challenge you and the one that bring you joy. What do you need to do to take care of yourself so that you are able to meet those demands? what are the steps? What are the decisions? What are the boundaries that you need to put in place? But be realistic, right? Because any one of us can say, you know what I'm going to do? I'm going to run a marathon. Okay. But if you've not gone to the gym in 2 years, guess what you're not doing next month? You're not running a marathon. Now, if you're playing, I think you would recommend that if someone's goal is to run a marathon, that is part of their, that's one of their objectives, one of their goals. The first step is in a resilience strategy is to do something achievable. What would you say to someone that said, look, but here's what I want to do. I want to do something really bold. I want to start a huge business. I want to, like I said, I want to run a marathon. How do you help them just take that first step?
And to add to what you were saying, yes, we will want that aspect, the supply and demand, and how to make that work better together. You will want it to be connected with each person's values as well, because that's where the meaning is going to come, right? Because otherwise, having, say, the to-do list of the kinds of things we could do or should do to increase our resilience, every one of us can have this, especially now having gone through the pandemic. We've heard the kinds of things that would likely help. Sometimes just the list is not, even the clarity on the list is not going to do it. It will work better if it is connected to our values, because then it has meaning. It connects with a purpose. And now we've got a motivation to actually start on those smaller steps. To your question, in terms of if you were to start with one small step, ideally it would depend for each of us on what it is. But one that I will tell you ends up often on somewhere on the plan here for many entrepreneurs I work with is to incorporate meditation. That's often a piece, because we're so action-oriented, solution-focused, resourceful, making stuff happen, right? Moving forward, rolling here, that even recovery for many people is active recovery. They are cyclists, they are going to the gym, they are runners, they're more of that type, which is really good. It has many advantages. We want to keep this. The piece that is often disregarded or even seen as, it's not for me, I'm not successful at this, I can't relax, the brain keeps going if I try to calm it down, so therefore it's not for me. It's meditation. And the success criterion, I would say here, is not to, oh, I've tried meditation, brain didn't calm down, it's not for me. You tried meditation. Did you press play on that app for 2 minutes and just sit there trying to do it? If you did, success, 100%, full points for just having tried it. And then do it again day after day. Because we know from research that's part of what will help.
Yeah, I as PJ knows well, I speak often about meditation, which is a part of my daily practice.
Sure does.
Wasn't always. It's relatively recent. I started doing it a few years ago. I've begun to be very, very methodical about it and make it a part of my everyday life, and for about the last year. And it is, I get what you're saying. I think without a doubt, meditation helps me be present, helps me stay mindful. And I'll use this opportunity, as I've said it before on other episodes, but I think it's worth repeating because it was the best advice anyone ever gave me about what the purpose of meditation is and putting it in context. A lot of people, like you said, think, oh, my mind didn't calm down, therefore I'm not good at meditation, or it's not working for me. When in fact, the appropriate way to think about it is, yes, your mind will wander. That's just human nature. But when you catch your mind wandering and you come back to the meditation, that's like doing a curl in the gym for your bicep. You're doing that for your brain. You're teaching your brain to come back, to be mindful, because we're always going to be distracted. This is really the essence of living in the modern era. We are distracted at all times, and there are many, many demands on our time. And the key is come back to yourself. Catch yourself, not being true to your values as an example, which I love that. I now get, as I was saying, as I was describing before what I was understanding, I left that out. And I'm so glad you brought us back to that, because I do think ultimately, sure, demands, whatever they are, am I here? All those things are great. If I'm not living according to my values, first of all, if I don't even know what my values are, and I would say a lot of people have not thought enough about what their values are, and that may be the best first step for anyone thinking about their strategic resilience plan is, what are your values? And I would concur with you. It's probably not 2, may not be 10, but whatever they are, what are your values? What drives you? What motivates you? Start there. What are the demands? This seems to me not just like a path for being successful professionally, it's a path for being a successful human being, living
Yeah.
life to the fullest.
Yeah. Yeah, absolutely. Has been associated to increased happiness as well. The degree to which we have clarity on our values and bring them to life in our everyday life, both professional and personal, will be connected to our level of happiness as well. So yes, it makes sense for a number of reasons. And that's what I do in the book, where I use knowledge we have from various areas of research in psychology, but just bring them to here. What do we need to know now to be able to wrap our plan and next steps together? So I often say, if you have a short flight, no, or a longer flight, you need to at least cross the continent, but you can go through this book.
That's that's very, very cool. So, you know, this is, first of all, I think it's right on the nose, right? I think you're shining a lot of light on something that a lot of people don't really dig deep on, because it's something that they kind of take for granted in a lot of ways. And they think that there's other things that need to be attended to externally, where they're not cleaning house internally. And, you know, just like Tal saying, in order to have a better foundation for carrying a better life, you have to internally be as solid as possible for you to enjoy the external bounties that you're about to get.
Or PJ, if I may interrupt you, not bounties, or the opposite of bounties, right? Because we all know life's going to throw shit at us, and we need to be just as resilient through those moments to get to the other side.
Yeah, yeah, and so actually, I wanted to ask Dr. Pelletier, what got you to resilience? Like, what was that call that brought you to this wonderful word that is such a cornerstone of our podcast, and also like just the entire entrepreneurial journey? What brought you to resilience?
The term that speaks to because most of the people I work with, like I said, are professionals, leaders, entrepreneurs, and managers. And that's a term they connect with. That's a term that for them speaks to the proactive aspect, the growth aspect, the reality of we'll go through adversity aspect. And so it's a term that connects, because seriously, if the term had been another word, I would have used it. My main goal is to help all these fabulous individuals, these fabulous minds, continue to bring their best to both their personal and professional life. And I don't mind what the door is. I'm practical here. So if that's the word that resonates, let's go through that door. And it does carry, obviously, we know from research, the right ingredients to deliver.
Oh,
very cool. Interesting. You know, it brings me to, you shared a quote with us in the pre-interview from Robert Cialdini, and the quote is, and I'll read it: "A well-known principle of human behavior says that when we ask someone to do us a favor, we will be more successful if we provide a reason for asking for the favor. People simply like to have reasons for what they do." And, you know, I think purpose and reason are, you know, two sides of the same coin. And what's clear to me as I think about this quote, and as I factor in everything we've heard from you in this interview, is that when our goal is to influence other people and influence our own lives, it starts with understanding how to motivate ourselves and what human behavior is motivated by.
Yeah.
Now, interestingly, as I thought about this quote, and you sent this quote in advance of the interview, and it immediately prompted me to think about the fact that I came across a different way to approach the so-called "do me a favor." I no longer use that language when I am in a position where normally I would ask someone for a favor. I now ask them to do me a kindness versus a favor. And I don't think it changes the point here, right? The point is that people like to have a reason for what they do. But I'd love your thoughts on whether, am I overthinking that staying away from asking for favors and asking for kindness instead is the direction people should be thinking about?
You know, I have not seen research specifically, you know, on that specific aspect. What I like in your particular situation is because you shared earlier with us that kindness is one of your values. It is actually pretty cool that you would ask for it this way. It almost like connects with your values. It makes it very TAL specific. It's personal. And so in it, I think what may be attractive to someone to respond positively to this in this case is that it does sound like you made a deliberate choice. It's a personal TAL decision. And when we're personalizing a message in general, that tends to lead to more positive results. So that's one. Along these lines, one piece of research that does exist, I've seen a study on this, that whenever you're able to add a because in your request, you're more likely to get this fabulous, very funny stories, and studies have been done on that. So that's another word to consider, that one that I do know research about, but not specific on this, although I love your personalization.
Is there a story that comes to mind, especially if it's funny? We'd love to share it with our audience.
Oh, that the one study I have in mind, many years ago, another one of my jobs early, while I was doing my doctoral research, I was a radio show researcher, and it was a radio show about psychology. So I was researching researchers in psychology that had done fabulously intriguing research. And this one team had done research about, how can you convince people to make certain choices and all. In that particular study, they were, and that's many years ago. It was at a time where in university settings, in order to get an article, you'd have to find the journal and go photocopy it. So there would always be a lineup at the photocopier, right? And so what they did is they would bring a person to the front of the line and say, would you let me go in front of you, cut the line, basically, because I have a class in 5 minutes and I really need this. And so people would say, yes, okay, do this. Then they would have the same person come in and say, okay, can I cut in front of you because I'm in a rush? And then people, they would let the person do it. And then they realized if they said, because anything, it worked. Can I cut in front of you because I want to make my photocopy? And people would say yes. So it was just a study, and doesn't mean it works 100% of the time, but it is a word that in that particular piece of research was shown to have an impact.
That's awesome. My son has recently brought to light the fact that whenever I say, hey, do me a favor, what that actually entails is what he calls a dad side quest. So it interrupts whatever he's doing. Could be homework, could be gaming, could be whatever he's doing. And I am sending him on a dad side quest to go do something for me, just like in fantasy books of lore, or just we have the main focus, but now we're going to do a little side quest. And so whenever I say do me a favor, so now I'm going to say do me a kindness, and let's see what happens.
Yeah,
That's
I'd be
what
curious to
happens.
hear whether he reacts differently to it. I believe that I've had more positive interactions with people since I've started using do me a kindness. There is something about do me a favor that some people find annoying. Another favor. Whereas doing a kindness, I'm finding people want to do a kindness. I want to do a kindness for you. What can I do for you, PJ, that would be something kind?
Dude, you do so much. You do so much. I can't ask any more of you, Tal. You are a veritable cornucopia of kindness. So,
well, I hope you mean at least a little bit.
I do. I do.
We
So, okay,
go
I'm
ahead.
sorry.
No,
No,
please, no.
No,
I insist.
Oh my gosh. All right. So, Doctor, just really quick, we're coming towards the end. I just want to ask really, really fast. What is, like, you've mentioned a lot of challenges that entrepreneurs face, time versus the demands that they're faced with on a day. Can you share with our audience what method you would use to determine where to invest your time and energy, and what strategies would you suggest for entrepreneurs who are facing these similar challenges?
Mm-hmm. So you could even have said, without saying it depends, MH, which
Yep.
I often have to say it depends. But what I would say is start with having a look at the basics. And then you can broaden outside of this, but the basics, and you know them seriously. If we had group of 100 people here and we said, what do you think are the 4 things that would likely increase resilience? You would say, yeah, there's exercise, sleep, nutrition, and relationship. And you would be right. These are the top 4. This is where the biggest body of research is. It's established. Some clinics in the US are lifestyle clinics, and they mostly work with these main criteria in order to improve people's overall health, physical and mental. So what I would say is, you're looking at your plan. Where do I start first? Look at how are you doing on these 4? And they're not in order. Although sometimes people will say sleep probably comes first because it's hard to do anything else if you don't have a good degree of this. But research has not officially formally said this is the first one. But I would look at your sleep and at the basics of sleep hygiene, which we know but don't always implement. Right? We still see an advertisement on TV, people working on a laptop in a bed. No, laptop does not enter the bedroom ever. Like, no. So sleep is probably where I would start and make sure you protect that, because if nothing else, as we age, sleep will be a bit sensitive to staying as healthy as it was. So the sooner, wherever you are in terms of age or how you sleep is, the sooner you invest in even better protecting the health of your sleep, the better. And then from there, I would build on the other ones.
Amazing.
Friends, our guest today was Dr. Marie-Helene Pelletier. Her new book, which is available, where is it available? Is it available on Amazon? Everywhere?
It is. Amazon,
Wonderful.
independent bookstores, wherever you buy your books. There is audio, ebook, print book, everything.
Awesome. So it's called The Resilience Plan, a strategic approach to optimizing your work performance and mental health. It's been out just a couple of months. It's already won several awards and it's doing very well. It's been really an honor and a pleasure. I think the work you're doing is really important work. Hopefully you are able to reach an even wider audience, and we're proud to be able to help you on that. And please come back. We'd love to. And next time you have when version 2.0 comes out, the Resilience Plan 2, we'd love to have you back on to talk some more about why resilience is such an important value, but why resilience alone, as we said before, plain old resilience is not enough. You need to be strategic about it. And if you are strategic about it, you're going to have a significantly greater odds of living the life you want and achieving the things you want to achieve professionally and personally. Dr. Pelletier, thank you so much for being our guest today.
Thank you. Thank you, Tal and PJ. And well said, both of you. And thank you for your podcast that's focused on this overall so important conversation. So thank you.
Merci
Outstanding. Thank you.